Harder to obtain some weight loss drugs. The FDA recently announced tirzepatide is no longer on their drug shortlist. This ingredient is used in Mounjaro and Zepbound. When a drug is on the shortage list, it can be compounded, so making it more available. But if it's not on the shortage list, a compound version usually isn't allowed. So to discuss this more, I'm joined by Dr. Nita Bijoor. She's a triple board certified physician from Oakview Medical Associates here in Greenville. So thank you for joining us today.
You're welcome.
So let's first talk about what is a compounded drug.
So a compounded drug plainly is a drug that's not approved by the FDA. So the FDA puts medications through a very rigorous process of testing efficacy, the safety, and the quality of the medications in the pre-market approval process. So a compounded medication means that it has not been vetted by the FDA.
So I think the big question is, are compounded drugs safe?
Well, I think the real question is, are you getting it from a trusted, licensed source? So I think patients need to be aware of where it's coming from, whether it's a FDA certifies certain facilities. They're called 503A and 503B facilities through the, there's a Federal Food, Drug and Cosmetic Act. So the FDA mainly says that unless the medication is on the shortage list, you cannot make a compounded medication identical to something that's approved by the FDA. So I think patients just need to be aware of what they're taking, where they're getting it from. And so the safety, I mean, there have been some concerns. There have been about 200 to 300 reports of compounded medications causing side effects, mainly because there are certain online pharmacies that are just shipping it out to patients. And I think that can be risky because patients self-administering, you're letting it, in their hands where they could misjudge the dosing and take a little too much. The frequency could be changed. So there have been hospitalizations, nausea, vomiting, pancreatitis, different cases. So I think just being aware and talking to your local physician is really important.
Okay, and they can kind of lead you in the direction of a trusted pharmacy.
Yes,
that's making
there are. The FDA
drug.
has a website where you can actually look at state licensed pharmacies. So always get it from one that is licensed in your state.
Okay.
Yeah.
And now I know this has to do with access as well as
Yes.
tirzepatide. It's what's in Mounjaro. I know for semaglutide, that's an ingredient in Ozempic, and you see it everywhere. Everyone's advertising, oh, we
Right.
compound it here. So for tirzepatide, what does this mean for access to that drug?
Yeah, I think the main thing is now that the FDA is saying that there's good, the shortage is gone, so there is medication available. I think another issue is the insurance companies are still not covering these medications, so they're still they're not cost effective, they're expensive. Many plans do not cover obesity. So here we are trying to get these medications covered for, United States has 74% overweight and obesity. So it's a huge pandemic. But I think the real issue lies in advocating for insurance companies to cover these FDA approved medications, and you won't have the need to take compounded medications. I mean, do you see online pharmacies selling blood pressure medications for hypertension? No, because right now there's a shortage. So what happens is it gives rise to a lot of other avenues of getting these meds and taking compounded medication.
To be made.
Absolutely.
So, all right. And I know semaglutide, what's in Ozempic, that is something you see all over the place. Do you think that could be taking off the shortage list soon?
Currently, I think we don't know. It'll be to be determined by the manufacturers, the processing, the supply chain, and also the demand. I mean, we have more and more obesity being addressed in primary care practices. One good way is to seek a board-certified obesity physician. There are many of us who are board certified, so we have the knowledge. It's not just these medications, but it's an all-rounded approach of really knowing there are other medications too. So if you absolutely need to get on the GLP, making sure you're getting it from a trusted physician provider group that's knowledgeable in it. They do cause 15 to 22% weight loss if taken over 72 weeks. So they're very effective.
So, just sometimes the side effects.
Side effects too, yeah. I think safety is number one.
Yeah, all right. Well, thank you so much for joining us today and educating people a little bit about what a compounded drug is. That's good information.
Absolutely. Thank you.